It is Monday, the 6th of September, 2021. We are delighted to be with you once more for another program, Fresh Perspectives. Trust everyone had a really good weekend, despite the circumstances, and are ready to face this new day and this new week. It is the first day of school, yes, and so we welcome everyone back to the classroom, albeit it's going to be a little different, but we welcome back all students, teachers, and everyone. Here's to a productive day and a productive term ahead. I am Brenda Baptiste, your moderator, and it is a delight to introduce our special talk panel, our Senator Christopher Allie and Mr. Byron Campbell. Good morning, gentlemen.
Good morning to you, Brenda. Good morning to our viewers and our listeners. Let me take the mask down from the ears and just say to everyone, it's a pleasure to be here again and to be partaking in this program. Of course, Brenda, I want to start on something positive before we go to talk about all the issues with COVID and all that has happened since. And to just say, this weekend I had the pleasure to reap some of my corn. That was given to me by my good friend to plant, and I did, and I reaped. So, see how he's laughing, he's happy. Yeah. Something working out from that side down there on the agriculture thing. So,
It's the evidence we want. We want to see it.
Yeah.
One thing you could say, well,
I'm going to bring my corn and rest it on the table.
But it brings home all morning listeners, viewers, wherever you are, pleasant day. But it brings home an important question of food security, and it demonstrates that individuals, families, backyard gardening, you can do something for yourself in a very simple way, and that's the message. That's very important. And there's a number of programs now administered by both the SIAP program and the government of Grenada to support backyard gardening.
And Byron, we have 2 lockdown weekends coming up.
Yeah.
It's a perfect time.
Gardening would be great.
Yeah.
The stress of
Absolutely.
I think there's something spiritual in going and touching water.
Absolutely. And it's important to know for that sector, what I understand based on the press conference that was held by the police, that for farmers, once you have your valid farmer's ID, I think there's some accommodation for farmers.
It's not even an accommodation, they listed it as essential.
Essential.
But
so
of course, you have to have your farmer's ID and all of that. So farmers and fisher folk, with their IDs, they'll be fine. They're essential. Yeah. They can go ahead and apply their trade without.
That's very important information.
Very.
And as we talk about that,
but we learned from the first time.
We learned. The question of going back to the PM's address, I think one of the important take home for me there was asking for unity, saying that this is not a time for blame, that this is the country, this is Grenada, and everyone needs to be on board, meaning the church, the opposition, the politicians, NGOs.
And the NGOs.
Everybody needs to come on board with it and see there's a national issue and it's not about division. And that's critical. That's very important. No, we're not blaming anyone. How do we? Because we need to do it collectively. This is about behavior, and I think that resonated with me, Chris.
I agree, and but I will hasten to add that the reality of the situation is that the society is going to be divided along the lines of vaccination and non-vaccinated people.
Yeah,
I can see our situation developing where vaccinated people are going to be allowed to attend certain events, go to certain things, whereas unvaccinated would not. You see happening in England now that they're only allowing vaccinated people to go into a football game, for example. And you see that happening and coming more and more in these countries like Europe and so on, where vaccinated people are given the priority to go to restaurants, in-room dine, in-house dine.
You're still an advocate for mandatory vaccination?
I am very much an advocate for mandatory vaccination. As a matter of fact, I was reading an article just this morning that came out in the Jamaica Gleaner, where OECS leaders were advised that mandatory vaccination is something that is available under the law. And it's not a breaking of any other constitutions or for employers, as a matter of fact. A little later in the program, I'm going to read an excerpt from employers where it speaks that employers are very much within their right to insist on mandatory vaccination for frontline workers. So they are at higher risk. And I mean, the legal test is about proportionality as well as reasonableness. And under the pandemic, those two tests can adequately be argued before the court so that you are protected as an employer if you insist that your cashiers, for example, need to be vaccinated because they're exposed so much to the public. And especially this particular virus, the Delta that we're dealing with now, is critical that we look at these situations. And, you know, I keep saying, and I've said, Byron, that I think the one boo-boo the government would have made, in my view, in handling and managing this crisis is not mandating our security forces, as I've said before.
Talking about policemen.
Police, the SSU, our nurses on the front line, prisons, customs, immigration. I think that group of individuals needed to be vaccinated as a priority. And now, as Brenda mentioned earlier, if we want our children in schools, especially secondary schools, to have face-to-face, our children and teachers now have to, in my view, be vaccinated.
Chris, you raise an important point here.
Just to go back to the not to lose what the Prime Minister's address on Friday. It was a really important address, and I would like to commend the writer of the address. It was very, very compassionate, I thought. It was very empathetic. I know the Prime Minister, his press secretary, is a very, very, one of Grenada's best writers. I don't know if she wrote the address, but I'm suspecting she is. She have a certain style that I picked up. And he did justice to it in the way he delivered it. I found he was very, very solemn, empathetic, and, you know, did what he needed to do to sound a serious chord, to say, hey, this is where we are in trouble, how are we getting out of this? So I would like to commend that. When I look at presentations, I pay very, very close attention to things like that. There are things that people would say, I saw people saying is nonsense and all of that. I guess it's based on their level of whatever they're looking for. I don't know. But in a general sense, if you're thinking about what the country as a whole is going through at the moment, I think as the leader of the country, he struck all the right chords, and a lot of what he said resonated and made sense, and really there's no argument with a lot of what he said.
Yeah, and I would not disagree that, Brenda. I thought he did a good job in presenting what he had to present. And you know, this is not a time for the blame game. Clearly, this is not a time. We have community spread.
You want to say that again?
This is not a time for the blame. And this is not about politics either. I mean, this is about...
Oh, you want to say that one again?
Uniting and really coming together to fight this virus. We have community spread, we have the Delta variant.
Yeah.
So this is about that.
There was something I wanted to just mention as you made the point about frontline and vaccinations and so on and so forth. When we think of frontline, we physically think of people who are at risk. So we think of our security forces, our health professionals, and so on and so forth. We're hearing from the police that, close to 100 of their men is now compromised by COVID-19. And there is some indication that some of our medical team as well is. But it's not just people who sit at the front. Barbados is having an issue with a serious outbreak of persons who work in inventory rooms, right? Closed up, right? So your storerooms, your refrigerated areas, people who work inside in those areas, they are having large outbreaks. So they are finding themselves closing businesses with because it's in a storeroom, the ventilation is poor. So anyone there who's susceptible to COVID, it goes around and it's circulating in the air. Because remember, when your droplets go out,
confined spaces,
right? So people are, inhaling and so on and so forth. So that is something that we need to watch here as well, because that's not unique to Barbados. Lots of manufacturing, lots of companies have storerooms with lots of staff and all of that. So that is something we need to pay attention to as well, and not just those who engage with the public.
Yeah. There's a dimension that I want to bring up because it's COVID related, and it happened last week. You would have heard of the stimulus package 2 This is significant in terms of where this stimulus is going to be directed. In coping, because as we are now, we have sectors of workers that are affected in terms of income, and given our poverty level where it's at, we know that part of the measures is that the Bushing program is shuttered for the time being. So we see a lot of money being directed in the stimulus package to the vulnerable population, particularly the SEED program, for example. Persons that were not registered in the program and were out of it are now going to be reconsidered. Specifically for the informal sector, some monetary support there, particularly those that are unregistered. You know, they're working vendors, fishers, whoever they are. So this is important, and also support for youth entrepreneurship, you know. So payoff support, persons who have lost income, another $1 million I think directed for unemployment support program through the NIS, I'm to understand. So this is going to be significant for the next 6 months, $34 million thereabout, to effect livelihood support, Chris. This is very important.
And I mean, I just want to add my 2 cents to the debate out there that some people believe that the Prime Minister and the government should have done a total lockdown and not do selective no movement weekends versus that. And let me just quickly add that I am in full support of the Prime Minister not doing a total lockdown.
Yeah.
Why? Because the government needs money to continue paying salaries and doing all that they're doing. The only sector now that is doing very well is construction. You cannot shut down the construction sector in totality.
Yeah.
We have community spread. Community spread means the virus moves with people.
Yeah.
So we have to find a way to reduce the movement, and we'll come to that later. When you look at the amount of students that are here through the SGU facility, students are back. You need to provide avenues for students to do what they have to do as well to support themselves. So I don't see us going into a total lockdown. Government can't afford, private sector can't afford. We cannot, some of us in our businesses, lock down and afford to pay workers whilst we're in the lockdown. We can't, we just can't. And there are some small and micro businesses, they cannot take another lockdown. They will die because they are so close.
Chris,
to
the counter side to that is, and what some of the debaters have said is like, look, okay, fine, we understand that. What the state of the economy if your health sector collapses? In other words, how do you balance this? In other words, at what point, if you have now 17 persons hospitalized, what is your capacity? In other words, we could do this, the argument goes, at the detriment of your health services sector collapsing entirely, inundated.
Well, yeah, that is...
So at what point do you, in other words, clearly we're climbing now. You know, what are the specific measures and that should be taken to change that direction? As we say, bend the curve, because clearly we're not there.
Well, I mean, the epidemiologists and those in the medical sector and public health that would know better than us, I believe that they have evaluated the situation. Yes, we have 17 people that are hospitalized now, and it could get worse. That is clearly a situation. But I believe they are looking at what the numbers are, the rate of infection, which is the positivity rate, as was said by one of the doctors, and how we need to change that. I think dropping the curfew from 7 instead of 9 restricts some level of movement. Businesses have to close earlier, a lot of that.
Yeah.
The total lockdown weekends back to back is going
the cut of non-essential movement.
Right,
Yeah.
cut of non-essential movement.
Yeah.
The restriction on beaches and I think that helps in the sense that we are reduced in movement, and this is what the virus needs. It needs people to keep moving and congregating and gathering. The churches issue, the funerals issue, all of that, I think helps keeping it. And I think what the government have done is let's test these 2 weekends and see what happens.
Right.
If there is a need, we can add on another 1 or 2.
Right.
But let us test it to see if it changes the direction of the curve and see what happens. I believe the curfew will be kept for a little while. Yes, it's impacting businesses like restaurants and so on in the takeaway service, and that becomes an issue. And I have argued that, you know, restaurants and them should be given some leeway if you're vaccinated versus unvaccinated.
Yeah.
I think once we pass this curve, they should be pretty okay, I think.
Yeah, we had a vaccinated event for cricket. couldn't come to cricket unless you was vaccinated.
Yeah.
We had,
people
when we were moving a lot in August, we had sanctioned vaccination events. But here it is, Mr. Campbell, just to speak to your point. So, you mentioned the debaters and us, John Q and Jane Q public, we have our feelings about what should happen.
Yeah.
But what are our feelings informed by? Is it our emotion? Is it because we are losing gains in certain areas, let's say our jobs, our business, or whatever? Or is it by the present sets of circumstances, which is a public health emergency on the island of Grenada? And who best can inform the policymakers about how they should go into handling this? Those who are experts. John Q and Jane Q, we are not experts. And so we need to be guided by that. Yes, we would have our feelings about things, and we should. And debates are generally healthy, even when they get contentious. But the epidemiologists, as Senator Allie said, and so they would have advised the government, I'm sure they did, on how to balance that. So the choices that were made as to what is restricted, how is restricted, is stacked up against that. Because we are in the period now, last week, this week, next week. I think this is going to be our worst period. And what I think the measures now is tailored to see how we can contain and arrest some of it. It's like, when you get a crack on your windshield and it starts to run. What do? So that's where we're at. So I think we need to kind of pay more attention to the whole and not just our own self-interest or the part. Or, man, how they could log along the beach. I'm a beach lover. I get to the beach, Saturday morning, the beach, you went on there. People came, they swam, they ran, they left. There was no congregating. The beach is going to reopen again. But for now, let's just do what we have to do.
So there's reason in what you're saying, Brenda, in that the different countries are taking different approaches. We've seen countries locked down for one infection.
Yeah, but we have a unique situation.
So and it's usually a debate between what the economics, the politics, and the public health issues. So there's a balance going forward. But you made an important point about the information and the misinformation out there. And I draw reference to a release put out by a significant church in saying that, and encouraging parishioners to get vaccination in general, and talking about the virtual services and so on. But they went on to state, and this is an important point, that we must be mindful about the long-term effects on children. And and I don't think that was appropriate. I think that's a medical question. That's a scientific question. And we don't need a clergy commenting on that, because I think the effect has been to parishioners, let me hold it on the children. And we talk about children, we talk about 12 and over, of course, So, and what we've seen now is a solidifying, it's a firming up of the anti-vax. It's a campaign now, clearly, and the misinformation. And the question is, how do we deal with this going forward? And we've seen that we're making important gains here as a result of people seeing the damage and seeing the results of in some cases, irresponsible action. And the increase in vaccination is very encouraging, I want to say, because for me, this is an important step in dealing with the pandemic and getting the virus under control, Chris.
Byron, I have always said that we live in Grenada as a reactive society.
Yeah.
We're not very proactive. I don't know if proactivity is in the diction at all.
Yeah.
Because we have preached on this program many Mondays, many moons.
I know.
That in order to prevent the situation we know, please consider getting vaccinated. Not that vaccination stops you from getting infected, but it gives you protection. Yeah. It gives you some level of protection, and it helps the society deal with issues that we were talking about, how to balance public health with livelihoods with health issue and lives. And, we had to wait until we got community spread. We had to wait until we have had 5 deaths, and I'm told it has increased. We have to wait till we have had 1,000 positive cases and climbing. For people to seriously take to the vaccination lines. I am commendable. I have high praise for the government having pop-up centers to do vaccination and testing. Because in community spread, you could say what you want. Testing is going to be one of the critical things to understand the level of positivity, the rate of the positivity, and how fast this thing is
and to tailor
spreading.
the response as well.
And to tailor, exactly, and to fit the response to the
Those
to the
numbers, that's the
situation.
data you're working with.
Yes,
That's the data.
and
It's science.
Yeah,
I am,
science, yeah.
you cannot say to the ministry that they are not doing. They have pop-up sites all over the country. You had in Spiceland Mall Park, you had in River Sally, you had in Food Fair.
Well, I
you
know
had
there's
a
that
number
one in
of.
Grand Mall and
That's
tomorrow.
right. That's right.
You
The
And-
pop-up sites need to be everywhere, even in the areas that are not. So, and I'm going to ask the minister this morning when he comes, because what we want to get a feel of is the locations in Grenada where we have the most, where we have the most
Brenda,
infections, right? So you want to ensure, and I know the Ministry of Health is really stretched, but you know,
Yes, they're asking for volunteers.
we fighting and we fighting and we have to fight. So you
have a
want
personal
to
crisis.
go into areas where there isn't even much going on there, because what you want to prevent is the eventuality of. Grenada is a small space where I was listening to a program last week, Shaggy, and a caller called in, and people are still talking in a very, very simple and base way. And after 2 years, it seems like many of us still don't understand how COVID, the virus, works. And this man was saying, so what's the problem? Just close down tongue. All the ministry say all the cases in tongue. It didn't know COVID in St. Patrick. It didn't know COVID in St. Andrew. Just close down tongue. And I was like, all right. And then when Shaggy ended the call, he made the point. He said, listen, the people from Tongue, they go to St. Patrick, they go to St.
And vice
Andrew.
versa.
The people from St. Andrew and St. Patrick, they come into town to work. And I'm like, you see, we still don't understand. It is our movement.
Nice.
It is our physical interaction that keeps this thing moving. It's so, you know, it is, and what can we say about that? That after 2 years, people don't even understand the basic way how this thing works to actually wrap. And that's why people finding it hard to wrap their head around measures and so on, because in their minds, they're unclear. And then you have so many people saying, this is just like the flu.
But Byron, what do you think about the police? The police,
It's crazy.
when they came out and spoke about, was it last night or?
You mean in the
Saturday.
the
On
press
Saturday,
conference?
Saturday night.
I thought it
press
was a
conference.
comprehensive press conference, very well managed. There was a lot of details given to the public, to understand how the various sectors are affected and what are individuals'
Their response,
responsibility.
because the bus thing have been a major issue.
The buses. I want to talk about Chris because that is absolutely necessary for persons traveling in public transportation to adhere to the protocols. And I want to say to businesses also, why I'm doing it now, my project, that if persons and where persons can work from home, please allow them to. It's important. The idea is that we don't have a lockdown, but we're trying to, the state is encouraging the restriction of movement, a restriction as where possible, and that's important. So in our individual workplace, and I've instituted that at my workplace, where you can work from home, particularly those that take in public transportation, allow them to.
Critical.
And that calls for a new type of management, because you want daily reporting, morning and afternoon, using your telephones, internet. And there's a lot of productivity, there's a lot of tasks that are very well, that can be executed efficiently in that matter. So let's understand that. It's not a lockdown, but don't move if you don't have to. That's the point.
So we're talking about a lot of serious things. You don't
WFH
laugh.
is not an easy thing for businesses, because I mean, it's an expensive ordeal.
That's correct.
You're
Working from home.
You have to deploy laptops with people.
That's
You
correct.
have to give them what we call VPN access to your system and your servers. There's a whole security protocol that is included.
So Senator Allie, it's kind of like how we plan. It's a new age we live in, and it's kind of like now how we plan for the hurricane season from June through to November. So that's what, and we're finding now that, and last week the question was especially raised, and I saw people asking on social media, how are businesses handling infections when it happens? Because people were complaining that they know this person, us. They know this person infected
Yeah.
there and this person
It's a
infected there, and look, the place still open, and so it calls into question now. And
Yeah.
here's an opportunity for us to get our health and safety protocols in businesses.
So,
Yeah.
Brenda,
Correct.
Let me tell you something.
You know?
I have a positive case instance by me.
You do.
I did. The young lady had to be sent home and isolated.
Yeah.
But the cost to the business is the key. You have to isolate for between 7 to 14 days.
Correct.
Right? Yes, NIS picks up some of that cost.
Yeah.
But the key for us is the loss of productivity. Now, all her direct contacts had to also be sent home.
Correct.
Yeah.
To be isolated. So I will lose 4 or 5 staff.
Yeah.
Right.
And that has a serious cost and in terms of productivity and what you have to do.
Yeah.
Now extend that and take that to businesses, and you're seeing now the banks are shutting down certain places,
Right.
pharmacies are shutting down.
Right.
Every conceivable part of the business community is shutting down in various areas
Yes.
Yeah.
for particular days, but then there's a cost to sanitize.
Yes.
You have to now sanitize. So we are in business. Some of the larger businesses could take it, but some of the smaller businesses, the cost to sanitize, put the protocols in place, and keep them effectively working is not cheap.
Yeah.
So we have a new line
But
on the business
the cost for
profit and loss now.
for not doing it is also high.
Okay, granted, but we now have a new cost item, HSC, health and safety.
Of
Yeah.
course.
And that if I used to budget $1,000 a month for now, that is 3 times that now. Right?
Yes.
And some of us, the cash flow. And
Yeah.
So I mean, there is a lot of complications,
Yeah.
but you're
Yeah.
correct.
Yeah.
As we go forward, just as how we have procedures and set policies in place for hurricane and the hurricane season, we will now have to do that for pandemics and epidemics and whatever epidemics we have coming, because it is now part of the
Whatever
environment
epidemics
and the
is real.
protocols that we have to deal with.
Absolutely.
And in my businesses, PPEs, because I'm a chemical business and we do PPEs was a natural thing, but we never thought about PPEs. You'll have to go to the point of wearing masks, face shields, erecting those shields in front of desks with people. I mean, there's a lot of things that we have to do.
Yeah.
Put up hand sanitizers. I mean, it's a lot. So at the end of the day, I'm saying to us as people, I think the main thing, Byron, in regardless of what we do, what the government does or do not do, we as an individual have to take responsibility
It's a personal
We
for
must.
issue.
you
Yeah.
and for your others.
Family.
We must.
Yeah.
And I always say to us, stand up in front of the mirror, point in the mirror, and see who it points back to.
Yeah.
It is you.
Yeah.
Now have to take the responsibility to follow your protocols, wear your mask properly,
Yeah.
sanitize, social distance where you can and when you can, and vaccinate. If you don't have a medical issue, I mean, let us not fool ourselves. It comes back to each one of us.
So the appeal that's been made, I assume there'll be some follow-up with meetings. I think the Prime Minister alluded to that, meeting with the private sector, the NGO,
He
the
did
churches,
meet with us last week.
social society.
I think he met with them prior
to
address.
so you have
So
So
buy-in,
his address, and that was also positive.
Yeah.
His address was informed based on discussions with key stakeholder groups in
Yeah, he met with
society.
labor as well.
Yeah.
He met with labor as well, so that he could get a feel as from everybody what would be
Absolutely.
the balance.
I want to make one point. I think, Brenda, you mentioned the word hurricane season. To keep in mind, folks, that we are in the hurricane season.
Well, we're in a
And-
September
and-
storm,
and
eh?
this
It's
is
called
a major-
COVID.
Look what happened on Friday. Friday we had a major downpour. In a very short time, we had significant rainfall. We had flooding in several areas of the islands, in other areas. So keep in mind, folks, that your plan or your preparation for this, we are in a hurricane season. So I know we are overwhelmed with COVID because that is immediate, it's urgent, it's an emergency situation we're facing. But we need to keep that in mind also.
COVID is our September storm, and tomorrow is 17 years since Hurricane Ivan.
Yeah, okay. Wow.
Today is the 6th of September, tomorrow is the 7th.
Wow, yeah.
And actually Hurricane Ivan was on a Tuesday.
Yeah?
It was on a Tuesday. COVID, watch yourself tomorrow, dear numbers, huh? So we are in a September storm, and we need to remember as well that September is typically the month when we have a lot of activity, storm activity.
That's correct.
So what we would not want at this time is to have a natural storm hurricane event, because that too would kind of how are we managing
Yeah.
this? How are you sending groups of people into shelters when we have the situation with the infection rates, the vaccinated vis-a-vis the, that kind of thing. So,
Brenda, I want to take the opportunity to read one thing here from you from the Jamaica Gleaner,
okay, go ahead.
which deals with my pet subject of mandatory vaccination.
Go right ahead, sir. Go right ahead.
And
You'll get very orgasmic about that. Go right ahead.
Why did she introduce this terminology?
It says, having demonstrated that mandatory vaccination is constitutionally appropriate given the leeway granted in favor of public health imperatives, it is submitted that employers could justify a requirement in a pandemic context at minimum where the workplace is a high-risk environment, such as healthcare or essential services, or for workers more at risk at the workplace, such as frontline workers interacting with the public. It is unlikely that employers would be held to a higher standard than a constitutional standard. This is reasonable both to protect other employees, the interacting public, and even the employee himself or herself, according to this document. And this document was submitted to the OECS heads by two of our leading constitutional experts within the region. And so the OECS prime ministers was given this brief to say that if they want to go that way, it is supported by the constitutions in the region.
That's a key point there. So the question is, where are the workers' representatives on this line? It would call for consultation, discussion. I'm not hearing sufficient from unions on this question. We've had some statements which alluded to get vaccination, but it's not commanding. It's not instructive.
Well, in defense of Tau came out with a stronger statement in recent times. Yes.
So are they going to support the mandatory vaccination?
Well, I don't know.
To the frontline workers.
I don't know.
Where it's essential, where it's a critical factor.
But it just goes back to show that when SU took their position, the hardline position, as some people thought, it is now supported by the legal construct that exists in our countries. So it is clear that we can go there, and I only raise it from the standpoint that I am so concerned about our security forces, and because when you call out the
security
police,
and health,
to deal with a matter, you don't care whether the police vaccinated or they have on a mask or not. You just want your matter dealt with. So a man threatening to chop up everybody in the village with a cutlass, you want a man or woman to be put down in whatever way. So it is unfair to them in the security forces that they are not vaccinated or not given some level of protection to deal properly with people. And you can imagine a police going in a situation and the mask, and they rip down the man mask, and the man will be down positive. I mean, come on, we need to understand that there are very peculiar circumstances that need to be dealt with in that way.
I think we understand that. The question is, do they?
Well, I always say military and so on, you comply and then complain. And whenever we send our military in foreign countries, or we do it in this part of the world, but SSU in particular, RSU and so on, when they go to other Caribbean countries and we send them out, we have to ensure that they're protected in the best way.
The situation now calls for a certain amount of firmness.
I agree.
Discipline.
Now, firm?
Absolutely.
No.
It demands that.
I guess that's where the genders become different. Because this is a volatile time. I don't know about except for the measures to keep us safe, I don't know about any extra mandating or squeezing. I don't know that any of that would work. It's like the pressure will bust the pipe. So in this case, what you do is that you stroke, you nurture. That's what you do now, right? Because we are already, the sore is opening, and we have to be careful what we put in there, because it might become gangrene. So we have to, so I don't know that now in this situation. I'm not disagreeing with what you're saying, but I'm not timing. And things have to be, and that's part of our weakness in this country and maybe in these islands, because life is a beach, but we need to do things with more strategy.
And
we need to be more forecasting, and that kind of thing.
Famous for never getting the timing right, but I want to say to this, the more we stroke and the more and I
No,
hear
it's
you
not
about the
the
pressure,
time.
I'm not
Yeah.
totally
Not the time.
disagreeing with you
Yeah.
on that.
It's not the time.
But with that stroking and that coaxing and so
Yeah.
on that you're talking about, be prepared to accept more debts
Clearly.
and be prepared to accept more consequences of the stroke.
The
So we have to be
Constitution
prepared.
gives the
We have to be
politicians certain
prepared.
authority to act, as you mentioned there.
All right.
Clearly,
We have the minister waiting. Our
Yes,
special
yes.
guest this morning is the Honorable Nickolas Steele. Heavy is the head that wears that special health crown at this point in time.
Certainly.
We have to
Yeah.
go out. But before we go, though, there's a lot of incoming for unnecessary and negative incoming that's going to SGU's way. And you know, our people, we need to watch that. We need to watch that. We can have concerns, but we need to watch that. They said they tested over 3,500 students, and 15 of those are positive.
Yeah.
SGU to pay the government, this, that, they lie, la, yada, yada, yada. All of SGU, and there goes again, SGU proving the vaccination point about when you get what can happen there if you're vaccinated. Yes, we can get COVID, but it's only like 0.4%.
yeah, very,
Because
very,
of,
very
exactly,
negative,
because
very
it's
small.
15 and there might be some more. But that's what it is, because the community of SGU, in terms of the students, the faculty, the staff and their spouses, etc., they are probably more healthy than, may say, another set of community, and they are fully vaccinated, so they can withstand what's incoming. So we also have to pay attention to that. But I think a lot of the ire that has been meted out to SGU in the last couple of days especially is really uncalled for. Really, really, really uncalled for. But anyway, folks, it is Perspectives. We'd like to thank all the broadcast entities carrying us this morning. And we take a quick break. When we come back, we have a discussion with our Minister for Health, the Honorable Nickolas Steele. We'll be right back.
Get Vax. It's your best shot. Hello.
A message from the Ministry of Health.
Tourism connects us all.
Welcome back to Perspectives. If you're just joining us, we welcome you to the program. And a special mention to all the broadcast entities carrying us live, our own Perspectives page, TNR Communications, Partygrenada, those of you viewing on Mikey Live, and to those of you on Sister Isle Radio in Carriacou on their Facebook page. That is MTV on air and online. It is a pleasure this morning to welcome the Honorable Nickolas Steele, our Minister of Health. The state of play in Grenada at the moment, all our health updates are very, very important to us. And we say good morning to Minister Nickolas Steele.
Good morning, Brenda, and good morning to your colleagues there and all of our brothers and sisters out there in Grenada listening and viewing.
Great. It's a pleasure to have you, sir. So before we start this interview, I just want to ask you, how are you doing? How is Nickolas Steele doing? How is Nickolas doing?
Brenda, I'm holding up. The team is holding up. I am one of a team, and I have a really strong support system at home. The ministry as well. It truly is enlightening and motivating to see some of the team members as they give it their all. We are where we are, and we have to deal with it. These are the cards that we have been dealt with, and we are the ones that have to carry us forward. And I think there are many other members of my health team that recognize that. We are going to have some very dark and difficult days ahead of us in the immediate future, but we will get through.
Right. Talking about dark and difficult days, Minister, as of Saturday, the 4th of September, 1% reported infections in the population. What is the current state of play as of this time?
Brenda, that number continues to grow. We had testing throughout the island on Saturday. We pulled back on Sunday so that the team could reorganize, restructure, and also rest. And we will start back testing and vaccination again today. Regrettably, though, in the last 24 hours, we've had 4 additional deaths in the last 24 hours.
4 deaths in the last 24 hours.
Yes, 4 additional deaths in the last 24 hours. This disease is doing exactly what it has done everywhere else. It is science-based. Deaths are doubling exponentially. Positive cases are doubling exponentially. And this is identified now most significantly here as a pandemic of the unvaccinated as well. We're seeing very little, if any, cases of individuals who are vaccinated. We're seeing very little hospitalization, if any, of persons who are vaccinated. And in our contact tracing and communicating to those who are positive that are vaccinated, they're clearing out in days, testing negative because their bodies are well equipped to fight this virus. And regrettably, this is the reality. It's not trying to twist any facts or information. Also, it's the reality here in Grenada, it's the reality in St. Lucia, it's the reality in the US, it's the reality everywhere in the world.
Minister, of the 4 deaths you mentioned, are you able to share with us the demographic, gender, and age?
We actually have, unfortunately, a 30-year-old who has succumbed to the disease, a 30-year-old or under 30 years old who has succumbed to the disease as well, but the majority of the other deaths are 50 and above.
50 and above. There are unconfirmed reports, Minister, that a cohort of nurses have come down with COVID-19. Can you clarify that?
Brenda, the wide cross-section of the community. This disease is in the community, and any and all individuals who are interacting in our community, are succumbing to the disease. Chris, you will be able to confirm within the private sector, the percentages of employees in almost every single company that have been affected, and healthcare is no different because our people live in the very same communities.
Right. But for the most part, are they doing okay? Those that you're aware of, are they doing okay in terms of their symptoms and their general health?
Up to my last report last night, there is 1 healthcare worker of concern with respect to their condition, but all others are stable.
Mm-hmm. Minister, can you name the areas in Grenada where we have, for want of a better term, well, the most infections, simply, and in health term, the epicenters, if you will, of this COVID virus here?
At this point, Brenda, it is everywhere, in every community. The numbers will be larger where the communities have greater percentage of persons living there, or they're tighter knit. Mm-hmm. But it is everywhere. There is no community that does not have a case of COVID-19 now.
Right. And have we put our hands on a demographic in terms of age, what we're seeing, age and gender, where we're seeing the most infections?
No, I have seen on Saturday a less than 1 year old baby positive.
Wow.
And grandmother. Once it enters a house, but significantly in our testing, we're seeing younger people, but that's because they're more mobile and able to come to the testing sites, etc. But and then significantly, those of concern are older, and these are people who have never left their home in most cases, or were not out at all. In some cases, these are shut-ins, persons who cannot leave the home. So it's coming to meet them. It's in the community, and people are bringing it home innocently. In some instances, it is because we've dropped our protocols. It has been 15 months, and it is difficult for individuals. Nonetheless, the threat has never been greater. Now, I've said that before, but the threat keeps increasing. And now, COVID-19 is in our communities, and we have to assume that every other person that we meet could be a positive person.
Yeah. Yeah.
Minister,
I'd like to extend our condolences to the family of the 4 who departed in the last 24 hours. Senator Allie?
Yes, Minister, good morning to you. And let me start off by first of all, congratulating and commending your ministry and yourself for the exemplary work that you guys continue to do and the sacrifices that your team is making. I think that you have done an excellent job. Forget all the nonsense about your arrogance and so on, but you have been saying months and weeks that, we could end up in this place. Grenada was on a precipice, and here we are. And unfortunately, we are seeing the deaths that is happening, as you have just indicated, and the positivity rates continue to increase. And that is sad, but it is the reality, and the situation now is how we manage going forward. You have rightfully indicated that our private sector and almost every business have been touched, regardless of where you are. I have been seeing the various closures and having to re-sanitize our places and so on. And I mentioned this morning that I had cases in systems as well, just to state that there is no business that is not touched by this particular disease and the crisis that we're in now. My question to you, obviously, this morning is that the government have instituted some protocols, as announced by yourself and Prime Minister, in terms of trying to change the direction of the curve. No movement weekends and an increase of 2 hours of the curfew. The question is, with these measures, and based on what the epidemiological situation is at the moment, and what the experts are saying to yourself and advising the government, how long do you think we are going to see the situation as we have now getting worse, or for want of a better word, increasing, versus when we hope to put an indent in the curve and to probably get it to go in the next direction?
Well, Chris, there are two determinants there. The first one is the effectiveness of the measures we have implemented, i.e. that if followed, that they would produce the right effects in terms of slowing of movement of interaction. And the other is, if followed, how much of those measures are actually followed by our brothers and sisters out there, our citizens. How much what is the level of compliance that we get? And that will dictate how quickly the curve slows and then flattens, and then hopefully goes to the other end where we're seeing a constant decrease. The other thing to take into consideration is that it is 10 to 14 days before you see the effects of any actions you take.
Yeah.
So the actions that we took from last Friday, it is 10 to 14 days before we actually see the effects of. And I think we all need to come to terms with that. So we need to recognize that over the next couple of days, it is going to get worse. It's going to be darker over the next couple of days. And that is from 10, 14 days ago. Our sacrifices and the price we are all paying recently, those results we're not going to see again until before next weekend.
The other aspect is of course, we have to commend you guys for the pop-ups in terms of testing sites and vaccination sites all around the country. The question is, because I saw a call came out for volunteers to help with the administrative background work in some of these sites in the various communities and places. Have you seen people coming forward to volunteer their services, or do we need to make a more clarion call to assist with you guys in all the different centers where you are putting pop-ups to help with testing, as well as to get a grip as to what the real situation is and how we respond to it?
We do need some more assistance with that. We can never have too many of those pop-up sites so that we don't have people moving too far away from where they live. We need to make those sites as convenient as possible, but at the same time, we have been affected like all other organizations or establishments with respect to our team also being sick from being infected in the community. So yes, Chris, I would like to get some more calls for volunteers. While doing that, I want to really recognize and let the public know the human service that has been provided and will continue to be provided by the nursing school, the young Grenadian nurses who are at SGU, the third-year nurses that came out on Saturday and were the majority of individuals who were doing the testing in the South and will be out on Monday, Wednesday, and Fridays. They have adjusted their class schedule to allow for them to give 3 days to community as opposed to being in the classroom 5 days. And I think that needs to be recognized.
And my last question to you for the time being is, how could the private sector assist the government in testing as well as providing facilities to help with the pop-up sites? Is there anything else we can do as a private sector to aid in this endeavor? Because we are also seriously impacted from a productivity standpoint when staff have to be out for 7 to 14 days.
Chris, yes, definitely. There are two things. There's always the support in terms of assisting us with logistics, tents, water, food for the volunteers, providing facilities that we can run pop-up sites, vaccination or testing sites out of. But significantly too, what I've seen in the last couple of days from the private sector is private sector telling their employees, don't come back to work until you come with a certificate that says you are COVID-19 negative. And without facilitating this. And as such, they're coming to the community sites and requesting something in writing. And that is inundating us and slowing down the process. We are trying to test as many people as possible. So when they come in, we're telling the people what their results are. But then individuals are coming to say, I need something in writing to take to my employer, which I understand where the employers are coming from, but we need to work together to facilitate this because it's creating an additional strain on the system, and it's going to be a regular occurrence over the next couple of weeks. Yeah. You're going to be sending your employee every 2-3 days to us to say, don't come back to work until you get something from the Ministry of Health that says you're negative. Or are you going to implement certain protocols in the workplace? Correct. That says, I do assume, and I have put things in place, that some of us here could be positive and asymptomatic, but that none of us here will be allowed to come to work with symptoms. But we have to assume that, and we have to be able to carry on business with an asymptomatic positive among us. If we all follow the protocols, it is possible.
Well, thanks for that, Minister. Byron?
Minister Steele, morning again. I can see the emotions in you, and we all feel the emotions in a moment and join in expressing condolences to the families who have lost their loved ones. This is not a good moment for the world, and certainly for us, for Grenada. The question comes up of you predicted more or less this situation by making statements at the past of the impact of COVID. So to some extent, we understood where this was going. You understood where this was going. You have a present situation where your hospital services is threatened. The last numbers we had was some 17 persons hospitalized. In your planning, what did you put at that capacity? How do you give confidence to the population that our planning and our public health infrastructure would be capable in some respect of its capacity to handle what's coming?
Byron, we have used the time to strengthen our health system, like all other countries. But like all other countries, this Delta variant and or COVID out of hand in the community inundates the health system. So our health system will be inundated. We will get to capacity, regardless of what that capacity is. In fact, we probably will get to capacity within the next week of all beds filled. And putting more beds there would be limited now to doctors. Getting more doctors, there is no country in the world that is capable of building up their health system to deal with an onslaught of COVID-19, widespread community spread of COVID-19. The countries that are now able to sustain normal life or so are those that have maintained or achieved a level of vaccination that prevents the health system from being inundated. Because the ones who are succumbing to the disease, 1 in 10, 1 in 100, are unvaccinated. So you try to reduce that number. But rest assured, our health system and our nurses and our doctors are prepared for it. We need to make sure that our public is prepared for it. All the oxygen and all the beds are there. But at a certain point, we do reach our limits. And we will reach our limits.
Lockdown has been proven as a measure of suppressing the spread of COVID-19. We know that the present measures are designed to do this. Some persons in the community argues that it hasn't gone far enough, that it should be more complete, so to speak. But what factors determine those measures, and how important, where do you consider, I mean, there's always a factor of the economy, the livelihood, but to what extent, how much is health infrastructure capacity given when you consider such measures?
Byron, that is a very good point. We have learned from in the past and from other countries, because we saw similar actions or reactions around the Caribbean. If you really clamp down, you stop the movement, but you can't clamp down indefinitely. So you can clamp down for 2, 3, 4 days in a row, keep everybody at home for 2, 3, 4 days in a row. But after that, everybody goes out. We've got to shop, we've got to go to the bank, we've got to replenish whatever stocks that we need or so. So we're all out there again. So too much constriction causes a series of no movements and then excessive movements. So all you do in that instance is what's referred to as wobbling the curve. You create a slow, but then in that slow you actually then create an acceleration of movement again. So we've got to find that balance, and that's what we're trying to do. That's why, I mean, some people will say that it's not enough, and some people may say it's too much, but you've got to find that middle ground that allows you to have a sustained, limited movement, and not that up and down.
Who normally emerges as the winner here, Minister? The public health professionals or the politicians in terms of the final measures?
There are no winners here, Byron, because there are deaths in the community. There are no winners here. There are no winners here.
Minister Steele, again, like my colleagues here, I really want to compliment you personally, sir, and your ministry, your department, and all the frontline workers for the sacrifices and the work being done presently, sir.
I just want to thank you and for that, and I will pass the message on to the rest of the team as well, those who want it to look at this program now.
Right. Just to follow up on something you answered earlier regarding as to what point the healthcare system gets inundated. Are there any contingencies, anything happening as it relates a parallel system in the eventuality of us, getting inundated and overly so?
Yeah, we do have phased movement. So we've moved out of the first ICU unit into larger, which is occupying an entire floor of the hospital now. An entire floor has been allocated to COVID ICU. That movement will be completed as of today. So that buys us a significant amount of time. And the hope is that in that we are able to flatten or slow that curve enough that we don't get inundated, although I've said we do expect it, that we don't get inundated, or that period is only for a couple hours or a couple of days at worst. So it's seeing what has happened elsewhere and recognizing the signs and being able as best as possible to stop it or slow it or delay it. So that entire floor now takes our capacity somewhere up to the 50s or 60s, worst case,
right?
In terms of persons in ICU. After that, we have a third site that we would locate to, but that each one of those sites involves shutting down other services and dedicating a certain amount of resources purely to COVID-19, which is why you couldn't do that from the beginning. So you have to do it as the case rates increase. So that is what we are doing, and I sincerely do hope and pray that we don't have to go to the third site.
I trust
Because in going to the third site, it implies a lot of other things. I'm sure that you understand.
Yeah, I trust so as well. The testing caravan, testing and vaccination caravans that started at the Spiceland Mall on Saturday, as commendable as they are, there was a video that made its way to social media showing some logistical inefficiencies. Are we going to be addressing that? And yes, the professionals attending to the medical side of things may be a bit inundated, and they probably laser focus on testing. So is some consideration being given to somebody or an agency or a business that's good in logistics to actually set up? So we ensuring that while we test and we vaccinate, people are maintaining their distances and all the things we want to see happen?
Yes, Brenda, and that is unfortunate. We put the logistics in place to be there to test and vaccinate. And we can call it an oversight, but never did I expect that individuals who were concerned as to whether they were positive or not, that we would have to actually get police also to crowd control, to tell them not to bunch up with each other and to break lines and not respect each other's social distance or physical distance. You're there to find out whether you have been infected or not, and we unfairly, regrettably, have to put police officers' health at risk and other health workers' health at risk to crowd control. And that is indeed unfortunate, but that is what we have to do, and that is what we will do, and that is why on Sunday we did not have any testing or so, and this morning we are not starting testing until we have those crowd control measures, etc., in place. Unfortunate and unnecessary, but it has to be done.
Yeah, logistical site layout and all these things help with that as well. Another one, someone on Facebook, and this is a very pertinent question, is asking about the disposal or burial of COVID deaths. How are we doing those? What is advised? What is the policy?
There is a protocol that says cremations. To date, we have not been inundated, but it is the protocol to be followed that individuals who have died from an infectious disease during a pandemic or epidemic, it is cremation.
All right, so traditional burial of the body is not in place for...
Not within the protocols, no. unfortunately and regrettably, as we've seen elsewhere in the world. I think the person is asking because they have seen that occurring elsewhere. They may be small amounts, and we will try as best as possible to facilitate in coordination with the undertakers and funeral homes. But they too need to assess their risk to their employees and their team members.
Right.
And it's a group discussion. I will not force the undertakers to do anything, to vary from those protocols, and we will try to make a humanitarian decision. It keeps everyone as safe as possible, but allows us to carry out our grieving process as best as possible.
A couple more for you, Minister. I know it's taxing, but a couple more for you. The vaccination messaging. Is the approach going to be a blended one? And when I say is the approach going to be a blending, it's an assumption that the messaging, the messaging will change. That's what my question is based on, an assumption that the messaging is changed. And if I'm being presumptuous in assuming, please correct me. Is it going to be one where we continue to encourage, but based on what has happened in our environment, is it going to be a case where we are now going to be addressing the barriers that people have to vaccinations?
Yes, Brenda, we constantly have to change the message, have to understand that the situation is changing, so the message of 2 weeks ago is going to be different. But I also think that we have to change messengers, or have to get additional messengers. And some of us have, many of you have clearly stated your position with respect to vaccination. And I think we all need to become messengers as well now and bring others on board, because those of us who have been vaccinated understand what's involved in being vaccinated and what the end goal is. And we understand as well that we won't get there if we don't bring the rest of our countrymen along with us. It can't be a them and us thing. It has to be us, and we have to get the rest of our countrymen through that level so that we can get past this. We don't want this to continue, nor do we want, once we get past this outbreak, to go back into it again. And what really is upsetting and almost annoying is while we are going through this period of lockdown and significant community hardship and deaths, 5 in the last 24 hours or so, we look at yesterday, Formula One in Holland, with all the crowds there.
Yeah, football.
No outbreak. No outbreak.
Okay, yeah.
Football in the UK, no outbreak of significance, no inundating of the health system because the majority of the population is vaccinated. Yeah. There are the examples staring us in the face. We just need to see it, open our eyes and see it and follow it.
Talking about messengers, before we let you go, I can't let you leave without slipping this one in. And that last Tuesday's post-cabinet briefing, it was exceptional. It really was. Dr. Taisha Donald and Dr. Mayana Charles, they were on with you, Minister. And the briefing, it was thorough. It was a sort of nurturing and soothing, so to speak. And that speaks to the competencies of the two doctors involved, their training and their skill. And the presentation was heralded all across Grenada in many quarters. It was really well received. But for me, I went back and I had a look at it. And here's what I came away with. And I don't know if that will make any sense. That the information, Minister, was rooted, it was a blend. It was rooted with medical information and public health information. Medical and public health. And I think that is what really made the difference there. The type of information that not just the presentation style of the doctors, but I immediately felt probably that was the missing component in some of it prior, and that in that type of reporting to the public, because it was so well received, you know, is that blend of medical and public health, is that going to be the new approach as we move forward?
Brenda, like I said, the message and messengers change, and I too recognize and we acknowledge that last week's presentation, the reception from the nation was totally different.
Yeah.
It is, I would put it down to the level of qualification, professionalism, and demeanor of the presenters.
Yeah. Information.
And I will not reduce their level of qualification and professionalism to single out because they were female. And what I want
at all. We're not
correct.
doing that.
Correct. What I want also is the population who have recognized their contributions last week to send positive vibes and thoughts and prayers to them. Remember, Dr. Taisha Donald is our Director of Medical Services at the General Hospital right now. So she's the one dealing with all of these contingency plans and these daily deaths before she comes back to the radio or TV again to smile and explain and plead, beg individuals to follow.
Yeah.
And Dr. Mariana Charles is on the front line on the testing and vaccination as well. And then coming back to the population to plead and smile and beg individuals to follow. So they are on the front line. So when they come back again, my hope is that their demeanor is the same. I do expect that because they are the professionals that they are. But you cannot fault them if you see a slight difference because they're going through this.
At this point in time, it would behoove all of us to leave faults where they are. We are in the ocean. Let's just swim.
Brenda, as you've said that, I've heard quite a lot of comments on up to Saturday. Individuals came up and asked, you know, what about the quarantine protocols and the entering protocols to the country? Why don't we should have 4 days, we should have 5 days, or we should have 14 days. What I want to say to that is there are countries that have 4 days, 5 days, and no days. There are countries that have 21 days quarantine with respect to persons traveling in. All of those countries have outbreaks of COVID-19 in their community. Once it gets in, and it will get in, so please, we cannot continue to believe that all we need to do is to have a quarantine system in place and all will be good. When your very health officials are saying not just here in Grenada, but worldwide, that is a stopgap. That is not enough. That alone will not work if we as a community do not get vaccinated, do not follow the protocols, and make sure that we don't have these mass spreader events before we all get vaccinated. We will have community spread of COVID-19. So it is not a blame game of pointing fingers and saying it's the foreigners or it's SGU or it's the people who visited. No, it is we as a people that did this collectively. We proudly celebrated in August. We had mass events. We did this together, whether it's those of us who said not to do it, like myself, and those of us who did it. We did this together.
Right.
And we have to get through this together. There are no policies to change except the policy of us and them. It's us, it's all us. And the time has passed for pointing of fingers. This disease does not point any fingers. It goes after all of us. Healthcare workers have been affected. Police have been affected, not in performing their duties, but because they are part of the very community that is infected. So the time has passed for this belief that it is a policy of quarantine that can get us past COVID-19. There is absolutely no policy of quarantine that has gotten any single country out of COVID-19. Why should we think we are different? What gets you out of COVID-19? Adhering to the protocols and vaccinations. And look at the countries that are coming out now. They are vaccinated And before vaccination, they adhered to the policies. We heard the President of the United States come on months ago and say, because of the level of vaccination, they can now reduce some of the policies. They've come back now to say, because of this Delta variant, they want you to wear the mask and so, but they're not getting inundated. Those states that are vaccinated, high level of vaccinations are not getting inundated. Look at who's ending up in the hospitals throughout. And it's there for us all to see, and we just need to recognize that we all need to look, and we will see, and we all need to follow the protocols. Please, it's not blame game unless we're willing. As Chris, you said earlier, you're pointing a finger and you see who's pointing back.
Yeah.
Yeah.
Gentlemen, final
Yes.
question for the
Couple-
minister.
Two questions for the minister. Minister, quickly, is there an appetite among the policymakers to go mandatory vaccine for the high-risk areas of our working force? And finally, in terms of the messaging for our school children, especially secondary ages 12 to 17, 18, that we have Pfizer, would there be a tweak in the messaging to encourage parents, hopefully, to get their children vaccinated so we can have, I know we're starting back with online learning from today, but face-to-face and getting our secondary school students back. Is there any thoughts around that?
But Chris, let me take the second question first. Yes, we will be directing messages, and let me take this opportunity to encourage parents to have their kids vaccinated. It is the one additional safety measure that makes the biggest difference. And on the first question of mandatory vaccinations or so, we have stakeholders and stakeholder consultations, and it is from that that we will make certain decisions. And there have been significant discussions with labor, with private sector, as well with the churches. From those consultations, we try to formulate a policy that encapsulates all of the various suggestions or positions taken. So I do hope that it doesn't come to a decision or further questions like you are asking of whether to have mandatory vaccination or not. The question only comes up when there is a lag in vaccinations. And it is for all of us to get people vaccinated. It's not for the government alone to put a policy in place, whether the policy is encouragement or mandatory vaccinations or not. It is for each and every stakeholder to take it upon themselves to get their members, if they believe in vaccinations, to get their members vaccinated. There is no reason why two beliefs need to be conflicting, the belief of choice and the belief of vaccination.
Richie?
Those two should not and are not in conflict, in my opinion.
Minister Steele, my colleague, in fact, has focused on the issues in my thought. But I just want to say that as we put our energies in the moment, because it is happening right now, that there are more long-term strategies with the understanding that COVID we'll have to live with this, and therefore the long-term strategy, which may include and consideration should be given on this point in terms of mandatory vaccinations for some frontline workers and others, and in some cases students also in schools, because there are already vaccinations that are requirement and mandatory. So I just want to wish you well, sir, and your department, and to remind us all that we're in this together. Thank you very much.
Thank you, Byron.
And Minister, before I let you go, what would you want the general public to know? What would you like to advise, implore, just where the state of our healthcare is, and as we move forward into this week?
Well, for many of us, it's a difficult time because COVID is in our homes, and we are trying to deal with that. And some of our loved ones in our homes are showing signs of worrying us. They're flat in bed, they can't move, or they have fever, they have aches and pains. And some of us have brought loved ones to the hospital, and some of us have already lost loved ones. So my thoughts and prayers go out to all of those individuals. those who are simply dealing with the threat of COVID actually in their homes, to those who have lost individuals already to COVID-19. And to the rest of us that we need to make sure that we are a support network for them. We need, as best as possible, to avoid getting to that position so that we can continue being a support network to those individuals. And we need to encourage each other to do the right thing. Whether the right thing is just simply wearing your mask and following the protocols, or, as many of us would say, the right thing is to get vaccinated so we can get past this. But we need to work on this together. And we also need to recognize the human service that our frontline workers, police,
Absolutely.
healthcare workers are providing, and give them some additional consideration, some patience and some understanding as well.
Absolutely.
They are the ones that all they're trying to do is to keep us healthy and to save us.
Absolutely. Thank you so much, Minister. It's been a pleasure speaking with you this morning. Well, a pleasure in terms of getting the first-hand information from you, but as we started the conversation and you shared the news about the deaths, it's really kind of put a damper on things emotionally. So we thank you for taking us through this. We thank you for leading our health services at this time, for all you do, you and your team. Extend our commendations to them and also our commiserations, because it must be trying for all of them. And we wish you and your family the best and look forward to speaking with you and hearing from you again. Thank you very much for your service.
Thank you, Brenda, Byron, my brother, Chris. Thank you all, and to all of your viewers and listeners out there. Stay safe. We will get through this together. Thank you.
We will. And you, sir. Bye-bye. So, ladies and gentlemen, that was our conversation with the Honorable Nickolas Steele, our Minister for Health, bringing to us the news this morning that just overnight, in the last 24 hours, we have had 4 deaths. Yes, you heard him right, 4. And he also indicated that our positive cases are rising exponentially. Mr. Campbell?
Brenda, wow, what can I say? I really feel this, you know. When I came in, somehow I feel different, you know, my emotions, you know, that's a lot for
it vacillates,
us. And it just brings home and what resonates with me is the fact that all the deaths indicated are on-vax. Most of the people coming down, hospitalized, are on-vax. The vast majority of cases on-vax. So the message is clear. We've been saying this before, that vaccination by itself is not the solution. The protocols, face masks, the hand washing, the physical distancing, but vaccination clearly is a measure to prevent, not preventing you from catching a virus, but preventing you from getting sick, which is the issue. You don't want to get sick, you know. I can catch the cold, the common cold, but I'm not in bed. I am over it in a day, you know. That's the point. So when I hear this is going to get worse before it gets better, you know, where do I set my emotions? So it's a difficult time for all, but we can do this. We're in this together. The danger with this virus, yes, we know that it's only going to kill a very small amount of people, probably 4.4%. That's the international numbers I hear from the FAO. But that's the point about it. In that you don't know where it's going to go. Who's going to? We heard about a 30-year-old person, someone under 30, losing their lives, which says it's not only the elderly. You know, so we're all in this together. We have to take this seriously. Remember, we have certain protocol and restrictions now. Employers, workers that can work from home. In other words, let's not move if we don't have to. That's the point. But we can work, you know, construction, different, the transportation sector. But let's do it in style. Let's do it with the proper practice. I think that's the message. This is what I want to say.
I agree. I think what we have to realize as well is that even though, and it's sad to hear that a 30-year-old lost their life to COVID, but what it brings home as well is that even if you're 30 and you're immunocompromised, you can, and then you don't have, let's say, the extra layer of the vaccination that you can go under. So it is just, it's really, really sad, and to hear that someone under the age of 1, you know, and that's who we have to try to protect.
And Brenda, what does
all
exponentially means? What is the number?
Well, we'll hear it later.
What is the number? How many new infections we have? Exponentially means what? The day before we had what, 200?
Well, not the day before. Saturday we had the new numbers. But remember, he came into it saying that I guess testing results comes in today, or maybe they got it overnight, but they just took a breather yesterday to reorganize themselves. So I'm sure before midday today we would know.
Exactly, and that's what the testing does, which is a good thing. It tells us, because of so many persons are asymptomatic, there's no symptoms, that what mass testing does, it shows up more, and it's able to take the persons that are infected out of circulation. And so that's a very, very important measure.
A bright spot too is when he mentioned that a lot of people are coming in, and then when you test again, they're fine, so they go out. And we're seeing, when you look at the flash report, you're seeing how the recoveries are ticking over. So it also means that there are people who are probably just exhibiting mild symptoms.
Absolutely, the majority.
Because Grenada is a nice wide open space with clean air and sunshine and all of that, and people, a lot of the things we consume and so help. But at the same time, nothing works by itself. And I keep saying it's a suite of measures. Washing your hands, watching your distance, all these things, it still works. Wearing your mask still works.
There's one final point I'd like to make, Brenda. This is dealing with the question of immunity, But there's a lot we can do, as a healthy lifestyle is important in terms of diet, in terms of consumer, and this is an opportunity to support farmers. Eating healthy, fresh fruits and vegetables, exercise. These are critical factors that's going to improve your natural immunity. And this is what we can work on in conjunction with the vaccines. And I just want to make a point that we have an abundance of fruit and vegetables here. A lot of fruits are in season now. Let's consume that. That's going to give us all the zinc, all the vitamin C, all the nutrients we need to build our
lots
immunity.
of fish, because we're not really exporting fish these days because
some
of
some are still being
going,
exported,
but we still have lots of really good fish available. So your phytochemicals and all these different things that we need. But those things don't work alone. And on the bus, I think there is a concern. But if we get on the bus and we wear our mask, okay, so you have your sanitizer, right? So I walk with mine everywhere I go. I spray in people door handle and all sorts of foolishness. Well, not foolishness, but taking care of yourself, right? So you have your hand sanitizer, right? You're on the bus. You have on your mask. Stop talking. Read. Check see what's going on Facebook. Read some articles somewhere. See what's happening. Check in with the boyfriend, the wife, the whoever. You don't have a conversation. Realize it's a small place. You come in from Sotes to St. George. Man, if you're on the bus, I could tell you're getting there in 40 minutes. So just buckle up. Put on your mask. Mum's the word. Good morning. You don't talk. Right? So nobody talking and droplets in the air and you're inhaling and let's just do. If we could do that, because it really calls for a lot of discipline. And no matter what we say, Mr. Campbell, it all boils down to human behavior and then to personal behavior. And I get the feeling that whenever personal behavior is mentioned, we take it personally and we start to feel like if somebody pointing at us. It's not that. What it means is that if once we understand how COVID works, personal behaviors.
It's true.
What can fight off COVID. If we don't move, COVID don't move.
Yeah, absolutely. Another important point, Brenda, is the level of misinformation that are on social media. And I want to make this point here this morning also, that you have chat rooms that the Nutmeg Association does, representing farmers, or the Cocoa Station does. And what's upsetting for me, they allow all this misinformation, rubbish, I mean like fake, false, to go without communicating to the senders or what are the rules on this, because these chat sites are very influential. When people post these rubbish there, hogwash, misinformation, it is taken as real by a lot of people. And I just want to warn against this. Fact check. It is so easy to go on Google to check the information, and in most cases, the fact check gives you the result. It's nonsense. It's not true.
Well, if you don't,
we just have to be careful.
yeah.
Here.
If you don't put an opposing view,
Yeah.
then the view they have is only the view that they have.
Yeah.
So it is critical. Like
Yeah.
for me, as strange as this may sound,
Yeah.
I read from the most ridiculous,
Yeah.
the most outlandish,
Yeah.
to the most scientific.
Yeah.
Because somewhere in between,
Yeah.
I really come away
Yeah.
with some understanding.
Yeah.
So yes, me
Yeah.
too. I go to
Yeah.
misinformation
Yeah.
sites and people
Yeah.
send me things. I look,
Yeah.
some of them like, really, man?
Yeah.
You know, but then I go and I internalize
Exactly.
it. And then I go and I find, so somewhere in between all the milieu of the crazy and the scientific, I find my center, you know? But that, of course, doesn't work for everybody. But if you have only one set of information out there, that's all people is going to have.
Yeah.
And so that's why there's some people, I've muted them on my WhatsApp because that's all they do.
They do,
and
yeah.
if they send to me and then I send back to them,
Yeah.
then they start to fight with me. I don't want to fight about us
You just-
being vaccinated. I
Yeah.
don't.
Yeah.
You've made your choice.
Yeah.
Allow me, please. Allow me, please. I don't go in people's face about vaccinations and yada, yada, yada.
Right.
I am pro-vaccination.
Right.
But I don't go in people's faces and
Yeah.
I work on who I need to work on.
Precisely, yeah.
You know? So
Okay.
just allow me, please. You have all your thing going on, how you feel.
Yeah.
I have a right to feel how I feel too.
That's
So let's just, because the divisiveness is really not working. And that's why I really don't like words like anti-vax and because with the anti and it just creates more polarization, right? So this what we're having here, this event that we're having here, I think we're all getting to feel and see for ourselves, and we will get to a better place. As hard as it is, as rough as it's going to be, as tough as the ministers say this week and next week is going to be, we are going to come to a place where we all feel it, so we get a better understanding of it, and then it will inform the decision we make. And that is my hope for all of us.
What a Muslim says that God's willing. Yeah.
Inshallah,
Yeah.
tomorrow. We'll
Yeah.
see. All about tomorrow, all about
Yeah.
next day. Senator Allie has had to
Yeah.
leave us, and we have to leave you.
Yeah.
Thank you so very much, everyone. Special thank you to Minister for Health, the Honorable Nickolas Steele. Again, thank you for your service, you and your team, yeoman service. I'd like to thank the members of the Royal Grenada Police Force and our commiseration. So many members of the force have come down with COVID, but trust that everyone gets over those symptoms and we move on. Everyone, stay safe. Please stay safe. Wash your hands, wear your mask, watch your distance. www. All right? And when you're going to the www sites, choose those that are credible. It's been a great morning, everyone. Have a great day for all of us here at Perspectives. Our camera person this morning, Mr. Curlin Dragon. Of course, Blondell George gave direction. Kirk Oliver is somewhere doing audio, and Nazim Benjamin for your professional streaming services. For executive producer Richie Oliver, I am Brenda Baptiste. Have a good day all. Bye-bye.